Keep your distance. A message from Vision Care for a safer tomorrow.
Sri Lanka's total number of COVID-19 cases so far jumped to 198 today after 8 more cases were detected in the past 24 hours, out of which 54 have recovered so far. This brings the total active cases currently undergoing treatment to 137, along with 165 under observation. The country's recovery rate saw a minimal decline, falling from 28.4% yesterday to 27.27% today. Recovery rates across the world have been on the up as countries have begun implementing stricter restrictions on public movements and have gotten a proper grasp on the outbreaks in their localities. Such upturns in recoveries are being taken as a ray of hope in what has been a terrifying 4 weeks for the entire globe. 6 of the new cases came from the SUDUWELLA area in Jayala, while 1 other was detected in DEHIWALA. 5 patients from SUDUWELLA were all associates of a suspect recently arrested by the police for theft, who had tested positive and had maintained close contacts with the suspect. Following the suspect's arrest last week, police and health officials moved to cordon off SUDUWELLA community, fearing a mass spread. The 6 cases were part of a batch of 28 youth who were transported to the Oliville quarantine centre from the SUDUWELLA area following the closure of the village. The 28 youth were all determined by intelligence services to have been associates of the arrested suspect.
මොවුන්ගේ ඇසිරීම ඉතාමත්ම ළඟට ආශ්‍රය කළ තියෙන බව තේරිච්ච හින්දා මොවුන් රැගෙන යන්න ඉස්සෙල්ලා PCR පරීක්ෂණයට භාජනය කරුන් ලැබුවා. ඉතින් ඒ අරන් ගිය 28 දෙනෙක් අරන් ගියා. ඒ 28 දෙනෙක්ගෙන් 5 දෙනෙක් මේ ආකාරයෙන් ආසාදයෙන් ලක් වෙලා ඉන්න බවට ඊයේ රාත්‍රියේදී තහවුරු වුණා. ඊට අමතරව අර අකරදැප්පෙදිය පත්වෙච්ච පුද්ගලයා ඒ කලහකාරී ලෙස හැසිරෙච්ච පුද්ගලයාගේ බිරිඳ මේ අතර ඇයව අරගෙන ඉලා තිබෙන්නේ නැහැ. නමුත් ඇයවත් මේ ආකාරයෙන්ම ආසාදයෙන් ලක් වෙලා තියෙන බවට තහවුරු වුණා.
Meanwhile, the COVID-19 positive wife of the arrested suspect, along with a 7-month-old infant, have been admitted to the hospital. Further PCR tests are being carried out in the area on persons who have had exposure to the 5. The SUDUWELLA community consists of 300 families, out of which a group of 50 more residents have been transported to the Oliville quarantine centre as a precaution. Meanwhile, it was revealed that the patient detected in DEHIWALA had arrived in the country from the UK in the company of another individual on the 15th of March. The patient had also undergone the compulsory 14-day self-quarantine period, but had reportedly developed symptoms a further 12 days after the end of his quarantine. The patient's associate has also been hospitalized after testing positive. Following this, 6 members of the DEHIWALA patient's family were admitted to the HOMAGAMA base hospital. As recovery rates continue to climb, the importance of recovered patients maintaining health and safety protocols cannot be emphasized enough. This was highlighted when it was reported that the patient identified as the first case from the Putlam district, who had been discharged from hospital and returned home, had ignored advice to observe a further 14-day self-quarantine period. When health officials had visited his home, he had been visiting the house of a relative, prompting officials to issue a stern warning to the former patient.
Lever Ayush Karabuneti Dantalepaya Shaktimat Datti Palakata